I first heard about pain consultants 10 years ago when I actually had an opportunity professionally to meet and work with Dr. Chu and his staff. I started experiencing back pain about 10 years ago, and I had an MRI and it did show some degenerative disease, some issues with two lower discs and a little moving forward of the spinal canal, and then aging, some osteoporosis. Unfortunately, I was diagnosed with an aggressive form of breast cancer and went through very aggressive treatment to get a handle on that, and I think I had some other issues with bone degeneration and deterioration of the spine. I also had to have a hip replacement, and due to that hip replacement, I think I had walked incorrectly for years, and that kind of malpositioned my spine. And one of the main issues I suffered with was stenosis. And so I sought a neurosurgeon's opinion on what I should do. And one of the things he said is, Diane, I've looked at your report and your films, and I highly suggest to you that you do not have back surgery unless you lose bowel and bladder control or you absolutely cannot walk. And that stuck with me. And so he gave me a prescription to come see Dr. Chu. And when he handed it to me, I looked at it and said, oh, I know him. So I felt very confident, having known him previously and then getting the endorsement from this neurosurgeon, this is who you need to see. I'm meeting with Dr. Chu and he's reevaluating my case once again. And I can tell he's contemplating what would be the best plan of care for her, because she isn't getting better. And he walks out of the room, he said, I'm going to look at your films one more time. And he comes back in and he's holding this little device about this big, and it's a spinal cord, and it's got like 4 vertebrae in it. And inserted into that spinal cord is what I thought looked like a bolt with a butterfly screw on the end of it. And I'm looking at it and handling it, and he starts describing the mechanism of how it works and how it provides the same results as a spinal fusion. But the thing that sold me was when he said, no general anesthesia, 20-minute procedure as opposed to 4 or 5 hours, the small device as opposed to a big cage that's put in, and recovery time is so much faster, lower risk of infection. I mean, these were all pluses in my book. And I told him, I said, this is the procedure for me. Let's do this. As soon as I woke up from the procedure, the pain was gone. I could get up and walk, I could sit, I could do things. And within 3 weeks, I was walking about 5 miles again, which was absolutely wonderful. I came back here for PT and they were all just amazed. They said I was hopping and jumping on and off the table, and of course their encouragement and training me of all the things not to do was very helpful. I was in despair and in a rut, but after the surgery, people were like, I can't believe this. This is wonderful. What did you do? And I've told so many people. I've actually had 2 people come here and have the procedure and had positive outcomes as well. So I am so glad that we have this technology available to us in our community. And Dr. Chu and his staff are amazing. They treat you with such kindness and care and consideration, and they understand that you're scared and you're nervous, and that it's a process, and they're with you all the way.